So there will be one station on the test 2 on the hoof and one station on the final, just so you know. So we've got the plantar slash palmar. The plantar surface would be on the hind leg. The palmar is on the front leg. Okay, just so you know. Yeah, palms of your hands. So palmar is front forelimb, and plantar is hind leg. Okay. And this is nicely done in your book. So you've got the, I don't know, where am I pointing at? Whatever. The toe, okay, is the front part. So if you had him sitting on the ground like this, the toe. And then you've got the medial and lateral quarter. There's no way for you to really know, this is medial just because the way it's sitting, but just, I'm not going to ask you whether it's medial or lateral quarter, because unless you know what you're looking at, it's hard to tell. And I think I'm right. I was told that this is the lateral side. They tend to shift off towards the side. See how these guys are kind of sideways like that? So this is the lateral. But the quarters, okay, and then the medial and lateral heel, okay, so the heel back here. Okay, so toe and heel, and then the quarters on either side. The white line looks like a white line. Nice. Okay, so the white line you can see here. And the significance of that white line is that it tends to be used as a shoeing guide. What the white line is a meeting of the sensitive and the horny lamina, okay, of the hoof. Remember, horny means hard, okay? And ha. So it's described as the horny part of the hoof, and that's what you cut, what you trim. And the sensitive part has nerve endings in it, and they interdigitate, okay, at the white line. So it's used as a shoeing guide. You do not want to put the nail into the white line, or you will get seriously kicked.
So that's it there.
That would be this here, yes. Okay, so there's the horny part of the hoof, and here is the white line in the sagittal section, and on the whole hoof, there it is there. So you just want to keep your shoeing nails on the outside of that. The frog is the part in here, and it's got a point. G, really? Okay. And the sulcus, there would be a medial and lateral sulcus. A sulcus is always a groove. We're going to see that when we get to the brain. This plural of sulcus is sulci, and the brain has grooves in it, and they're the sulci. So here's the sulcus of the frog, and in a live animal you could tell whether it was medial or lateral. The sole, okay, this part of the hoof. The bars are these guys here. So here's the wall of the hoof here, and then the bars are what kind of dip in on the side. Okay? So it's part of the hoof wall, the bars here. Okay. Okay. So the heel back here. These, it's not written on there for some reason. The bulb of the hoof, of the heel. Okay, the bulb's back here. I think that's labeled on your, yeah. Okay, so the outside surface, okay, you've got your coronary band, the coronary band or coronet. You can see it nicely in this horse because it's got nice short hair, but of course the feathers of like what, Shires, draft horses, yeah, are gonna hang over that. But this is the, or the coronet, the coronary band or coronet, is the originating tissue for the hoof. That's where the hoof grows from. Okay, so it'd be like our
Nail bed.
Nail bed, that's it. What's the proper name for that? No, not cuticles. Your half moon. Should have gone and looked that up. It doesn't matter. Anyways, that's where the hoof grows from. I got this all on. Okay. Toe, quarters, and heel. Okay, but yeah, that's where the hoof grows from. Okay, so when we do a sagittal cut, approximately mid-sagittal, you can see the bones that are involved. Which one do you think is the cannon bone? It's this one, the big long one, okay? Now, what do you think that structure is?
Would that be growth?
Yeah, that would be an epiphyseal plate. Okay? Epiphyseal plate, okay? And so this is just the proximal epiphysis and the distal epiphysis. Okay, so the growth plates don't close evenly on animals. What's the matter?
It's just a baby.
The baby. Not totally a baby because this one's disappeared. So there you go. So that would make this, what bone would that be? I'm not doing this in order now. Hard to put flesh on it sometimes. Okay? What's the scientific name for this? That'll help. It's the cannon bone, but what's the scientific name for this? Or the medical name, whatever.
Meta something?
Meta.
Is it a front foot or a back foot?
Oh, it's a front foot. It's a front foot. Good question. It's a front question. It's a front foot, so it's metacarpal 3, okay? So that would make this a carpal bone. It's one of the carpal bones. Okay? And so this would be the, or what, proximal phalange, okay, or long pastern, medial phalange, or short pastern, and distal phalange, or coffin bone. Okay, so I can label any of these joints. That's why I don't mind not having a horse leg on the test, the skeleton, because I have a horse leg, yeah.
Are you going to label the parts of the bone on this?
Possibly. Medullary cavity or medulla, okay? Possibly, and I've done that. You can see holes in it, some places where the pins have been in. So I've done all kinds of stuff on this. Specifically name this part of the bone. Distal epiphysis. Distal epiphysis. This is the diaphysis, and this would be the proximal epiphysis. Certainly, I have labeled the epiphyseal plate, carpal bone. Just name this bone, scientific name or common name. So make sure you're reading the question. Because scientific name or common name, you've got to know which is which for any of these. Okay, so this would be the navicular or distal sesamoid. So some of the bones you can't see. We can't see any of the splint bones on this because it's a mid-sagittal section through the hoof. So the splint bones are not part of the equation on this test. Okay, so the phalanges, I've got 1, 2, and 3 there. I want proximal, distal, and medial. Proximal, distal, medial. And then, of course, knowing the parts. And the joints, potentially either scientific name, common name, or both. So here's your metacarpophalangeal, which is the fetlock. Okay, your interphalangeal, proximal interphalangeal, which is the common name is the pastern joint, and distal interphalangeal, which is the coffin joint. Okay, so know those guys. Okay, and white line, wall. Okay, I can do that with stickers. Has to dry out for a bit, but I can do it with stickers. Okay, frog. Okay. Coronary band. I usually do coronary band if I'm going to do it on a whole hoof, so I might have both of these on the same tray. where am I? Horny and sensitive laminate, just the idea that they meet at the white line so that they interdigitate at the white line. Wall, sole, frog, I've done, so the sole is out here. So you can just look if again, usually I label those on the whole hoof, the sole and the frog, but I could label them on here. Just look at where the frog ends. There's the point. So this part here would be sole, and this is the frog. You can look. Okay, sorry.
It's okay.
Digital cushion, okay, is areolar connective tissue filled with fatty material. Nice. It does what it says it does. It's a nice cushion for the hoof. Distal sesamoid, already did that. Navicular bursa is this guy here. Okay, this here, that is right inside the joint. Okay, the digital cushion is outside on the just above the frog of the hoof, but the bursa is inside the joint, smaller. Okay? And again, it cushions it as well. Okay, navicular bursa there, and then superficial digital tendon and deep digital flexor tendon. So superficial digital tendon is the most it's not very good on this one. It's this one here, okay? It's the most superficial, and it kind of fades out here. You can see its connective tissue wrapping and joins in with the deep digital flexor tendon. So the deep digital flexor tendon is the one that goes all the way down and attaches to the coffin bone. The superficial one is more superficial, okay? So hence its name. Deep digital flexor tendon, just superficial digital tendon. There's no flexor in the superficial name. And that's it. Okay. The chestnut and the ergot you've got pictures of in your book, and I haven't put those on for a long time. I leave that for med nursing.